Good morning, everyone. My name is Dr. Ruth Bush, and I, along with my co-chair, Dr. Kathleen Ozsvath, are thrilled to introduce you to Season 2, Episode 4 of the EmPowHER series from Vein and Lymphatic University. I'd first like to thank our Chancellor, Dr. Lowell Kabnick, and the President of VLU, Dr. Victor Kanata. Thank you for this opportunity to share our experiences with people around the world. I first want to thank our sponsors, BD and Boston Scientific, for providing this unique opportunity. Today's Season 2, Episode 4, which is the end of Season 2, is going to focus on women leaders from around the world. We're going to have a roundtable panel type discussion. And if there's any questions for anyone listening in, please put them in the chat. I will have my panelists say more about themselves, but just briefly, we have Dr. Ozsvath, who's from Albany, New York, a vascular surgeon. Dr. Meryl Logan from Austin, Texas, in the United States, a vascular surgeon. Dr. María Botero from Bogota, Colombia, also vascular surgery. And Dr. Souad Benallal from Algiers, Algeria, also a vascular surgeon. So we have this tremendous wealth of knowledge and women leaders. So first of all, I'm going to call on each of you to get this party going and just ask you to say a few things about yourself and answer the question, what inspired you to pursue leadership in medicine? I'll start with you, Dr. Ozsvath. Tell us a bit about yourself.
Thank you so much, Ruth. First of all, you're the best partner in crime ever. It is so much fun to do these webinars with you. And I just also want to tell everybody we're going to have a Season 3. More to come on that. I am a vascular surgeon in upstate New York. I'm originally from Dallas, Texas, and I ended up in New York, 30 years ago. As far as leadership roles at work, I am chief of surgery at Samaritan Hospital, which is in Troy, New York. And I hold various positions within our hospital system. I'm also very involved academically. I'm sure you all know Dr. Bush is the immediate past president of the American Venous Forum. I am the current secretary of that organization. I'm also the past president of the Eastern Vascular, and I'm on the executive board of the International Society of Women Vascular Surgeons. What got me interested? Well, first of all, when it came to leadership roles at my hospital, I did not seek them out. I just showed up to work. I worked hard. I got along with people, and my CMO pulled me into his office one day and said, "Hey, you want to be chief of surgery?" And I kind of said, "Are you talking to me?" And he said, "Yeah." And I was like, "Yeah, with some mentorship and help, I'm happy to take this on." And that was about, 10 years-ish ago. So I don't know that I specifically went looking for it, but it kind of happened, and it was very organic and has been an incredible experience. Same thing with the academic roles that I have. I've had incredible mentors, including you, Dr. Hingarani, Dr. Kabnick. These were all people that just kind of, opened the doors. And that's pretty much it. I'm also a mom. I have a soon to be 23-year-old daughter. And that's one of my proudest accomplishments. I'll stop there.
Awesome. Thank you so much, Kathleen. Let's move to Dr. Benallal from Algeria. Tell us a bit about yourself and why you're in leadership. What inspired you?
Hello, everyone. I'm Souad Benallal. I'm professor in vascular surgery from Algeria. I'm currently chief of vascular surgery and organ transplantation departments in Algiers, the capital of Algeria. I'm also expert member of the National Transplant Agency and member of the training team. I'm General Secretary of Algerian College of Vascular and Vascular Surgery, and also of General Secretary of the PAVA, Pan-Arab Vascular Surgeon Association. I have my journey was not easy. I have full difficulties and challenges, because in Algeria the vascular surgery is considered as orphan, because there is only three functional departments in all Algeria for more than 45 million inhabitants. I was lucky to have a great master, Professor my Professor Bayet, to whom I pay tribute, who instilled me love of specialty and scientific and pedagogical educational spirit, and to never give up or back down from one's goals. So currently, I have a great team in Algeria, the big department in Algeria. Thanks to God, I'm very happy to be among you. And I have big challenges in my life and in my quotidian. Excuse me for my language, because I'm French speaking, so I do effort to speak English. Thank you.
Awesome. I think it's wonderful. Dr. María Botero, why don't we go with you?
Hi, how are you?
Hey.
As I was telling you, my name is Ana, and I lived my whole life in another city. I just moved to Bogota to be the chief of vascular surgery for Fundación Santa Fe de Bogota, which is a major hospital in Colombia. I was the past president of the Colombian Association for Vascular Surgery. I'm currently the president of the Colombian chapter for the Society for Vascular Surgery. What got me into leadership? That's a tricky question. I was kind of thrown into it by a mentor that I had. I was part of the board of the Colombian Association, and then the board ended its period, and Dr. Jorge Hernando Ulloa, who was the current president, told me that I needed to be there, that he wanted more women into this association. So I got thrown into that. I became vice president and then president. And I think it's not something that you're born with. I think it's something that you develop with time. And then I started to meet all of you in different scenarios, and I wanted to be just like you with time. So you've been inspiring to me and to many other women, and I think that being here is something that needs to be done for women to see that there's a seat at the table for them as well. So I'm living currently in Bogota, which happened a year ago. So I'm starting a new practice and everything, which is very hard. I don't have any kids. I have 2 dogs and a horse. That's it.
I've seen pictures of the dogs on Instagram,
Yeah.
but I have not seen the horse, Anna.
I
I
have a Spanish horse, which is, I do dressage. So that's my sport.
Awesome. All right. And Dr. Meryl Logan.
Hi, thank you so much for having me join you. This is really fabulous. I'm Meryl Logan. I'm in a new practice as well. So I took a job 7 months ago at UT Austin in association with Dell Medical School. It's my first civilian job after I left the military. I did an integrated residency training at UC Davis, and I think Kathleen and I switched places because I was born and raised in New York, and now I'll probably be in Texas for the rest of my life. I would say I'm on like the first step of my leadership journey. I was brought into this position because I really love to teach, and we're looking to start training programs for vascular fellows and vascular residents here in Austin, where as the 10th largest city, we have no vascular specific training programs. So I feel like that'll be really exciting, and I'm hoping to learn or to continue to learn from people like you, especially Ruth, who's one of my previous mentors and editor of JVSVL, which I'm one of her associate editors for, on how I can be a good leader and hopefully continue to move up, with the first step being a program director. So thank you so much for having me join you.
Awesome. What a great group of leaders, not just women leaders, but leaders in all of your areas. I have some guiding questions, but I want to use a couple of the comments that were made by some of you for the first round of questions. Mentorship was mentioned several times. So how important was mentorship or is mentorship in your journey? And how would you tell someone who is looking to get involved in leadership, and whatever that is, whether it's on a national, international level, local level, how would you tell them to seek out mentors and also to seek out sponsors? Because I believe probably all of us had sponsors, and there is a difference between a mentor who you share things with and a sponsor who's specifically going to help open those doors for you. So I'll just put that out there for anyone to start talking about mentorship and sponsorship.
I'm happy to comment. Boy, I know I would not be where I am today without both. And, you know, it's very interesting because there are those people in the background that at the time something is happening, you don't even realize how much they've done and how much they've helped until you look back. And I think that, you know, those people are the key ones as we sort of mature through our careers. You know, I have to say this, early on when I was a resident, Anil Hingorani, who's also part of VLU, was my third year resident when I was an intern. And we became very good friends and have maintained a 30-year friendship. And again, seeing how he took care of patients and his involvement sort of helped lead me along and wanting to be a vascular surgeon. There were some other people as well that were very important in my training. Donna Mendez, the first African-American woman to have her vascular boards. She was at my hospital. And I remember thinking, gosh, I want to be like her. And then later on, you know, there were other people as well. Like when I never even thought that I should be professor of surgery. And I remember Vivian Gatton picking up the phone. She was in Syracuse at the time. She said, you know, it's time. And she was extremely helpful to me. So it wasn't the people I was working with that recognized the important step, but it was somebody outside of my institution. That was Vivian, and she really helped me a lot get my CV together. And I mean, I have countless people. Lowell Kabnick, he was my, you know, he was one of the attendings when I was a resident. And again, so many doors. You, Ruth, I mean, you're an incredible, you know, role model, and we've worked very closely together in many different ways. And you know, again, I think there are a lot of people who are visible in as you in your career, but there are also people in the background who are extremely important. I'll stop there.
I would agree with everything Kathleen said. Being newer on a leadership journey, I have so many mentors, and sometimes I don't even realize what they've done until they've done it. David Dawson, who is my program director, and then my partner in the military, and now just a great friend and colleague. I mean, I just remember early on as a resident, he's like, here's the SBS email to apply for committees, do it. And at the time I was like, oh, I don't want to do one more thing. I'm so busy. But now I've been the chair of the social media committee. I've been on several committees. And because of that, I've met so many people in the vascular community and been able to do so much. And it was all because he was just like, you're going to do this. Just do it. Just apply. You know, I met Ruth when I was in the military at the VA in Temple, and she opened up the world of like veins to me. And now I'm running my own vein center. Like Leanne O'Banion, a friend and colleague that I've never actually worked with. She's like, hey, you want to be involved with me on these things? And open my world to other things. So it's like so many people that you just randomly meet that, you know, just take the opportunities, be like, okay. It's really been really inspiring.
Awesome. Thank you. Souad or Anna? Role of
Yeah, for
mentorship,
us-
sponsorship.
For us, it's kind of different because I was more like 5 to 6 years in a hospital working every single time, and I wasn't going anywhere. Like I was advancing in my surgical career, doing surgeries, the bigger the better, but nobody knew. The only one that knew was me. So when I had kind of this reach into places that I've never was invited, was when I went to societies and that I knock on doors to be part of a presentation. I went to meetings and congresses and everything, that I got the opportunity to be in places like this. And also you gotta commit and you gotta do what you gotta do, but there's people along the way that have helped me get into this, because I thought that that I didn't deserve this, that this was serendipity or everything else, a little bit of imposter syndrome. But it takes time, practice, and a lot of work. And you also have to show the world that you're there. So you have to be available to go to places and speak and ask questions. So I think that if these places are available, you need to show up and you need to talk. And for us in South America and Colombia as well, that's the main thing, that we don't get this kind of exposure. So for me, many mentors and many sponsors had me here.
Souad.
So for me in Algeria, we have in this decade, in the last decade, we have an increasing of the number of women surgeon in different specialties, and especially in vascular surgery. I have more female residents, and this is a positive point for the future. I'm very active, and I have for me it was a challenge to become chief of the big department in Algeria. I have more difficulties and some I can say I have some animosities from colleagues, but thanks to God, in this time currently I have a big team. And I am active. I participate in the Congress meeting, education, formation of the residents, of students, and I tell them there is no difference in gender, especially in all specialties, in particular in vascular surgery. There is no difference between genders. The competence are not defined by genders. We must. I said every time to my residents, you must believe in yourselves, and there is no difference. And if I said every time, if a woman is capable to give birth of child, she is capable to do anything in the world.
That's a very powerful statement. Thank you, Souad. I have to say that I have had tremendous mentors and sponsors, and I still do. Dr. Lowell Cabnick, you are one of the biggest sponsors and mentors that I have had, and for many women. And I appreciate advice, one-on-ones, as well as sponsorship of so many. And I think it is critical that we continue to do that, men and women, and giving opportunities. I do want to talk about something that several of you alluded to, and Anna just blatantly stated it, and that's imposter syndrome. So I think that this is a very real thing, both men and women, particularly women. Maybe it's getting better as there is more gender equity, at least in terms of numbers for medical students, as Souad said, for vascular surgeons, and particularly when you look at younger generations. However, I have found one of my roles where I am at the medical school as associate dean is that with the younger women, there's still doubt and self-doubt that they can go into surgery, specifically vascular surgery. And honestly, I also tell them that imposter syndrome gets better. But I have to say, for me, it does not completely go away. It does not completely go away. There's still self-doubt, when I'm giving a talk, when I'm getting up to do something. It happened at the American Venous Forum last week. You know, here I am supposed to give a presidential address, and I was feeling like a fraud right before that time. So I would like to explore this with you all a little bit more, and what advice you have for general population who might be listening about imposter syndrome, and how to, maybe it's not overcome it, but how to cope with it.
Yeah, I agree. This is such an important topic. I suffer with imposter syndrome all the time. It has gotten better. I'm now in my 6th year of attendinghood, but I still have it. And so a few things that I found helpful is just talking about it. Like, don't suffer in silence. Like, talk to your senior partners or your partners. And then it's really nice every once in a while for them to just bring you back to reality and be like, didn't you do like 10 cases last week? And these are really hard and people can't do these things and you did these well and you're a good surgeon. Like, remember that. So I think that's really helpful, is talking about it with other people. The other thing I found to be helpful is training residents, because they have it, and opening yourself up to them and being able to talk to them, because then they want to come to you and talk to you, and having an exchange and be like, yeah, I feel that too, actually. And once they see that, I think it makes them feel better and realize like, oh, well, my attending feels this way sometimes. Like, okay, so that it's normal. And then we can have a dialogue. And going along with that, I have 3 kids of my own, and I also like, I'm not ashamed to like come in and like look like a mess and be like, I have to do this or I have to do that. And I think that really shows them like, okay, I can do this. Like, I can be a surgeon, I can be a mom. Like, I don't have to be perfect, but I can still do all these things. And like, one of the things I have to do today is in 3 minutes, I have to hop off this call and go around and go to a soccer game. And that's okay. But again, I'm still working on it, but I think it helps to like not keep it bottled in and talk to other people, because we all have these feelings, whether we show them or not.
I think there's one other caveat to this. And for those of us certainly who have probably faced, a lot of issues just based on the fact that we were female. I mean, when I was in medical school, I was told I couldn't be a surgeon because I'm female. That was in Texas. And I smiled and went up north because I figured in New York, they've got to be nicer. But, there's that whole issue as well, where you feel like as a woman, you have to be not only better, harder working, than your male counterparts. And there was truth to that. I think today it's getting a little better. But I think I would venture a guess that every one of you has felt that. And, it makes us who we are. It makes us good. It makes our, surgical outcomes good. A little bit of competition is probably a good thing. It's when it kind of overtakes you when it's not good. But I think it just takes a lot of time. And I do also think that as a female vascular surgeon, it's probably taken me longer to get to where I am today than it did some of my male counterparts. Which again, it is what it is, and it's fine. But these are all things that is sort of unique to us with our gender. I'll stop there.
Meryl, before you hop off, and I do want to hear from Anna and Souad, before you hop off, what advice do you have for upcoming generations? Because you're now going to move into being one of those older generations. It's going to happen.
I think my advice is to just be yourself. Do the things that interest you, take the opportunities that excite you. And it's also okay to say no to other things, because you can't do everything. There's just not enough time to do that, and you'll really run yourself ragged. But by really putting yourself into the things you love, you'll find other people that do those things too, and that you can like build each other up. And that's really how I've kind of found my path in the last few years. And thank you, Ruth. You're just a fabulous mentor, and I know you'll continue to be a great mentor for years to come. So thank you so much for having me on.
No, miss you, love you, thank you. Any thoughts, Anna, because you brought it up, or Souad, on imposter syndrome and feeling like a fraud? Does it still happen to you?
Yes. Very much every day. Like yesterday, I did a carotid, and it's been a while since I had one of those very hard cases. And this was a 72-year-old male with a very severe stenosis. And I have a sister that's a lawyer, and she lives in Miami. And I told her, I gotta go and I gotta stop somebody's brain circulation for a while, so I'm a little bit stressed out. And she was, what? What are you gonna do? And I said, yeah, I'm a little nervous, but I think it's going to get better when I'm doing surgery. And she told me, do you understand what you just said to me? Like, the things you do are things that not everyone can do. You're about to go and operate on someone and maybe save his life. So every time somebody says something like that, you're like, okay, yeah, this is what I do, and this is special. And I've been studying for most of my life to get to where I am. So it's hard. And when somebody puts you down, or when somebody does something to you that puts you down, it takes all the work that you did. So it's hard to get back to being confident and knowing your value. And you were talking about residents and training and all of this. It has helped me a lot, because some of my students come to me and tell me, you're amazing. Like, what the things you do, the procedures you do, the way you handle yourself within the hospital, because now I'm starting in another hospital, and hospital politics are not, they're difficult. So I'm very thankful for them. They're keep me grounded when I'm feeling like I'm not enough and I'm not good. They tell me, take a little piece of time and look at yourself. So that's what I do every now and then, to remind me that I'm good enough, and that everything that I do is because I love what I do, and that patients benefit and the students benefit from that. So that's a cool thing to do if you have students.
Souad, any comments? Imposter syndrome?
So we live in continuous stress. We make a lot of sacrifice, but our happiness is when we can manage and take care for our patients, to can give care, and we are functional. So this is our objective.
Keep it patient-centered. Yep.
Yes.
So there is a question in the chat from Dr. Rebecca Riachi in Mexico. What do we think about the glass ceiling? So I think, Rebecca, what you are asking, is there a ceiling for which women cannot go any higher? I think we also have to forge our own path. So I will say there probably is a ceiling, but that's a self-created ceiling, or it's not necessarily by women, but also by women and men. So one thing we did, led by Linda Harris and Paul Mashaw in the United States, was when there was and is a ceiling in the Society for Vascular Surgery, is started the International Society for Women Vascular Surgeons, to give women the opportunity to be in leadership positions, to have a place on the podium, to have networking opportunities. So I say, we moved the ceiling. The ceiling wasn't moving, so we moved the ceiling. And because you can't, if you're not given the opportunities, you can't learn the leadership skills. So it wasn't a statement of a competitive organization. It was allowing younger generations to have those growth opportunities, and for senior women as well, to be able to experience them and gain the skills and gain the experience, and know that that yes, we can do this. So do you experience a glass ceiling where you are, Kathleen? I would say you're chief of surgery. Why aren't you chief of the hospital?
There was a comment made earlier that I agree with, and that is that, when you're offered opportunity, it's important to take it, and it's important to know your limitations as well. So you can't be everybody's everything and be perfect and all of that. So I don't want to run the hospital. Well, I'm very happy with the people that are running the hospital doing what they're doing. Chief of surgery is great. It fits kind of what I do. I love doing it. I love working with the other surgeons. We built an anesthesia program from scratch. I'm now involved in starting up an orthopedics program. I didn't know anything about anesthesia or orthopedics as far as, day-to-day stuff, but I learned it. And these are the opportunities that you go after. It's, again, going back to the question of when you get opportunity, where is it coming from? The opportunity to be chief of surgery totally came from my CMO. It did not come from my group at the time. So again, I think that there are glass ceilings. However, you can break them, as you beautifully just pointed out with the ISWVS. You either you continue to work hard and people will recognize it and then offer opportunity, or you create your own opportunities. The nice thing, with ISWVS, that's been really a great experience. And there are women like Linda Harris, like Palma Shaw, like you, like where we have opportunities, and with networking, we can offer it to one another. And I think that was the point of that when Linda first started that. But yeah, I think opportunities are there. You got to take them. You have to do a good job when you get them. If you don't do a good job, they're not going to ask you again. And it never hurts to say, hey, I want to volunteer for this. And if you do a good job, you will be recognized. Just one other comment. My hospital, the CEO is female. The chief of nursing is female. The only man that I can think of is the CMO, and he's a gynecologist, and he's really nice to women. So I'm kind of in a lucky environment. I'll stop there.
That's great. That's great. Any other comments on glass ceilings? I think I love Kathleen's comment. We just break them. I learned from one of my mentors and sponsors early on, Dr. Joanne Lohr, that you have to do a good job. Joanne would even critique some of my statements when I would apply for a position, a women's grant, something, and she would say, you had typos in that, and at first time she did this to me, I was a little offended, and then I realized she is helping me. She's taking the time to read it. She's taking the time to call me. She's taking the time for me. And I think that's what we have to do, again, for those that are we are training, those that we are mentoring, and those that we are sponsoring. And we don't help anybody if we don't help them get better and help them improve. But we also have to understand that not everybody, like Kathleen said, wants to be chief medical officer or be whatever. You need to be the queen of whatever queendom whatever your sphere is. We do have another question in the chat from Dr. Vargas in Florida. How can male colleagues and leadership actively support and advocate for gender equity in vascular surgery? How can we advise our male colleagues to help us?
I think that we have to recognize that there are differences between us and that the gap is closing, but we still have gaps in positions of power among hospitals, and it's hard to get into those. And first of all, we need to say that there are differences between us, that the gap is being closing, and we need to have those hard conversations. But because when you put this on the table, not everyone likes it. Like, It's a hard conversation, but we need to have those, and we need to have those with our partners, with our friends, with our family, with people who doesn't notice what happens in our world. I mean, things are getting better. That is what I can see, but we still have a lot of work to do. I also wanted to comment on the last question, and leadership came to me almost as an accident. So right now I wanted to do something to get more knowledge of leadership and things behind everything that happened to me. And I'm actually doing an MBA. And I've found things that changed my whole perception of leadership. And I've met people that are in the army, that have companies of their own, that are third generations of companies in Colombia. And I've learned so much from people that they don't have anything to do with medicine. Right now, it's like 60% women in this MBA, and they have programs for women leaders in every single work in life that doesn't. There's 4 doctors in the MBA. So I've learned that the things that happen to us not only happen to us, it's everywhere. And that, as you said, if there's a glass ceiling, we need to break it and make another one, and break another one and break another one, and also pay it forward. We need to look not only for women, but for men that support women, people that are open to new ideas of leadership, because leadership has changed along the years. 10 years or 20 years ago, leadership was doing a list of shifts and managing a program. But nowadays, leadership is a lot of stuff that we don't even know. So education is key, I guess, and having the opportunities to talk about these topics, even with your family or with your partner, I think is very important.
Souad, any comments?
The same in Algeria. Indeed, we have increasing representation by women entering and medical schools. So there is a changement in the cultural shift. So there is no difference in gender. There is equity in between men and women, and sometimes the patient prefer female than male, because woman is more tender. She take her time to hear the patient, to be affectionate with affection. So the comportment of women is I can say is more better than men.
So that's a very important comment. So what I will say to that end in the United States is one of the talks I give, and I'm doing one next week on medical legal issues involving surgeons and physicians in the United States, and women physicians have many fewer allegations, legal claims brought against them, probably because of the communication, the spending the time with the patients. Patients don't sue physicians for the most part because they gave different care, or the outcome, they think something is not being told to them. So it's really about that dialogue with the patient. So I do think that is one of the characteristics that is more predominantly female, or traditionally female. Let me change topics. I want to talk about, how do you balance? And it's a tricky word, right? The term balance. How do you split your time between clinical responsibilities, leadership responsibilities, and that may be what you do. I don't do as much clinical work. I mainly do leadership, and personal life. For me, I do not have children, and I actually don't even have any dogs right now. But I do have a spouse who wants time, and I have had aging parents. I still have one aging parent that we take care of. So I think balance is going to be changing every day for me, and it depends on what's happening that day. I think that with younger generations, it is more not only expected but accepted. If you need to say, I have to step away, like Meryl, she needed to go to her kid's soccer game. That's incredibly important. People who have children need to be there for their children. I don't think that used to be the case 20, 30 years ago. So I think what I'd like to know from you is, how do you balance your being a surgeon and having a personal life? Riding your horse, Anna, how do you do that?
I go every Saturday and Sunday, but I'm not good at this topic, you know. I gotta be honest, it's still a struggle for me to do that. I tend to do everything with 100% attitude, so it's intense. So my both parents died. My dad died like 7 years ago, and my mom died 2 years ago. So I don't have children and I don't have parents, but I was a primary caretaker for my mom and my dad, and it takes a toll on you, of course. And in general surgery, I suffered a lot physically and mentally. And that is why I keep on telling you that you have to think that you cannot put people with the things that you had to deal with. So my main thing is for us to understand that people need to sleep, need to eat, need to have a timeout. If people are feeling stressed out, you need to catch on that to help others. Balance, I don't think that word it's achievable. Yeah, because as you said before, life changes, and you change city, and you have to start all over, and you need to open your consult, and you need to work a lot more than you were working. If you, like me, started a new position a year ago, so it takes a toll on your family, on everything. So it's cool to take time to like slow down a little bit, and you need to speak up and say, you know, I'm failing at something, because there's something that takes a toll because you're working, or because you're doing things about leadership and going to these meetings and doing things at 11 p.m. or 1 a.m. So I know it's hard. For me, it's very hard. If you have any advice, I will take it, like, for sure.
Dr. Ozsvath, Dr. Benallal?
I so agree with you, Anna. Oh my gosh, you know, I don't even know where to start with that question. There is no such things as a balance, because the balance is always tipping in different directions. Oh my, I think you have to forgive yourself when things don't go as planned, or you know that you're hit with something that is not 100% the way you would have wanted it to go. You got to just move on. My 93-year-old mother moved in with me. She has Alzheimer's. I cannot even begin to tell you how difficult that can be. I think the thing to remember is we are human, and it's okay to ask for help. So I have, 24/7 caregivers for my mom. Sometimes I feel guilty that I'm not home more, but they do a better job of taking care of her than I do. So one of them cooks and provides food so that so that I eat during the week. I call Ruth all the time, on the way to work, on the way home from work. So I have and I thank you for that, Ruth, for listening always. I think creating those friendships and the support systems are incredible. That's what gets me through the day on a daily basis. So thank you all for that. I think somebody mentioned, just bringing it up and discussing this. I mean, this is a real thing. And I think a lot of women, and probably men too, you work really hard and, you forget that there are other people in the same position. And so reaching out to one another, talking to one another, being there for one another, I think that's what makes all the difference in the world. And don't be afraid to ask for help. It's okay to do that.
Any comments, Souad, on balance in your life?
I say that the journey of women surgeon leadership is a long flight. There is many sacrifice. Unfortunately, I haven't children because every time I change the state. Currently, I live more than 700 kilometers from my family.
Oh.
So every day there is a sacrifice, but I'm happy because my objective is one. So I repeat, women must not given up or back over. If she has a purpose, she must do everything to success.
Just to add to that, when I never thought that I could have a family. It was pretty clear to me that if I was going to do vascular surgery, then being a mom was going to be wasn't going to happen. And it was actually one of my male colleagues. He was one of my mentors. He said to me one day, you should have a baby. Like, it's okay. Like, you can do this. It was Duraj Shah. And I remember thinking, okay, well, that's a good idea. Maybe I will. And so I would bring Elizabeth with me to work because there was a daycare at Albany Med at the time. And I would bring her to morning rounds. And Dr. Shah would grab her, hold her, walk around with her while we would be doing, morning report. And then I would take her over to daycare and we would do our day. So, I think it's one of those things that you might have a certain misperception of what you can and can't do. And what you realize is that there are people around you that are going to be very supportive. And, he was such a family person. And that really helped. Also, I had an incredible support from, I didn't have any family locally. And so I had really wonderful people in my life that I could rely on to help with my daughter. And I remember once feeling very guilty and saying to her, are you upset that I'm not at every event of yours? And she's like, no, mommy, I'm proud of what you do. And I thought, that's kind of cool, and now she's 23 and applying to graduate schools. And, I think she understands what it means to work hard. And that was because, both myself and my ex-husband were good role models in that way for her. So don't let people tell you can't do what you feel like you need to do.
I want to add something to that, is that there's no good or bad way, or there are different ways on becoming a mother. I tried for years and I did the whole thing. I did IVF, everything that you could imagine.
Wow.
And it took me 2 years to stop and say, if this is not going to happen, I'm not going to torture myself anymore. And I'm just going to stop. But I've always talked to my younger vascular surgeons or surgeons that if they want to become a mother, they have to know that, because age is something that really takes a toll on fertility. And I've been someone who suffered that. So if you have an insurance for your house, car, or everything that you own, why don't you have an insurance which would be to have your eggs retrieved when you're young, and maybe if you want to become a mother later on in life, it'll be easier for you. And that's something that we keep very quiet. And when I did all these treatments, I did it very quietly because I was very scared that I was going to fail, that I was going to get sick, that I couldn't, that I wasn't going to be able to go to work with all the medications. And I did it for 2 years without nobody noticing. But
Oh,
that's
wow.
also,
Wow.
but we have to normalize that. You know, we have
Yeah.
to make sure that as women, we support each other. We talk about this stuff because it's not easy. When you say I want to become a mother and I haven't had the chance, and I'm 41 and I'm not a mother, and I think I'm not going to be a mother in that way. And I'm okay with it. But some people that still have the chance, I think it's really important for us to bring a little bit of attention. We do radiation. We our professional life takes a whole lot of years to be done. So we tend to say later on in life, later on, I'm not ready, I'm studying, I'm working, I'm just starting my professional career, how come I'm gonna become a mother? And if you really want to, I mean, that's an advice for my point of view because of what I had to go through. That if you have the possibility to save your eggs, do it when you're 25 or 26, not 30, 38 or 39, like I did. So that is a little piece of advice that I give every student.
I think that's very personal and very critical. I appreciate you sharing that story with us, Anna. I don't have children, and that's by choice. I've never wanted them, but that was, for me, that was a discussion that my mother honestly could never get over. You're a woman, and why don't you have kids? But I think you are absolutely right. Fertility, and this is a whole nother webinar, is a discussion. It's not just the age, it's also the stress that all of you are under. That doesn't make whether you want to have children, adopt children, or raise children. That is a whole challenge in and of itself, each one of those things. So I appreciate you bringing that up and bringing it up with your younger colleagues and your students. As I tell my medical students, there is no good time. There is no good time. So you gotta make the time. And you use the term, Anna, time out. You have to take a time out. I learned early on with my husband, we had to actually plan when I was a junior faculty and was working all the time and on the weekends. And I'd go in and we'd work on papers and do all the stuff you have to do as a junior faculty, that we had to set dates. We actually had to schedule date night and pick a restaurant, a week or something like that. Because if we didn't, and we didn't set it up ahead of time, we're not normal people, ladies. It's not just going to happen. Our time is not always ours. And then
I can't agree
at the end of the
more.
day, I text Kathleen, and she tells me to buy some more shoes. That'll make
shoe therapy.
Shoe therapy.
Mine is bags.
I believe in it. Oh yes.
Bags and horses. I don't know which of them are more expensive. I think the horse is my guilty pleasure. But it's also something that I do to relax and decompress, which is very, like, for you, not your family or your husband or your partner or your colleagues. You need to have something that grounds you, that resets you. So that is mine. It's like something that I do, and I cannot think of anything else. Once I'm there, everything is shut down. So that is something that we have to do, because if not, you have to shut it down, because your brain is always working, and that is the only place on earth that I can lower it a little bit.
So Kathleen or Souad, what do you do I love that, shut yourself down and do something else? How do you stop your brain from working?
For me, it's reading some independent medical books, independent for literature, and do sport or music.
Oh. Do you listen or do you play?
Both. I have the viola. I mean, I'm not a good player, but I'm beginner.
Okay, good for you. Good for you. Probably can't focus on medicine while you're trying to learn to play.
Yes.
That's awesome.
What about you, Kathleen?
Well, I mean, to me, friendships and spending time with friends and is exceedingly important. Going out to dinner, calling you on my way home. Those are the things that really help me sort of disengage from the day. Talking to my daughter. I do want to also say, Anna, thank you so much for sharing that very personal story. And I completely agree with you. I was talking to a medical student recently who told me that in medical school now they talk a lot about freezing eggs and this kind of thing. And I remember when I first heard this, I thought, oh my gosh, I can't believe they're discussing this in medical school, but what an important topic. I mean, by the time we get done with our training, I mean, I was, like I said, when I was 38 when I became pregnant, and then after that I was unsuccessful. And I'm sure it was because of my age. And then these are things that women deal with, right? Men can have children, forever, but women cannot. And I think that's an extremely important discussion. And maybe we'll think of this as a webinar topic, Ruth, for the future.
Yeah, and having male and female voices on there, because it for me it was a conversation that my husband and I had to have before we got married, because that was that was my choice, and I think we also need to know from our partners, our spouses, how they feel about it as well, how they feel about it. Well, appreciate you all. We have 3 minutes. I want to ask one more question. This is on global health. What global health issues do you think we need more women leaders to take charge of? A global health issue. Where could we make an impact?
I think that women are, when we complain about something, we get very disregard, even as patients. There's a book that's this pain, that's named This Pain Is Not Mine. And it's like we get thrown out by colleagues or doctors, and I've seen it as a physician training male surgeons or medical doctors. And I think that we need to pay attention when somebody says, I'm in pain. It doesn't matter if it's a guy or a girl or whatever they want to, but we need to pay attention to that. And I think in pelvic venous syndromes, it is the topic. I've had patients that have told me, I've been in and out of the ER. I've been going into these consultations. I've been going into these doctors, and I wanted a female surgeon to see me and to look at my disease or whatever that I have, that I don't know what I have. And you go further with studies and everything, they have a congestion syndrome, a pelvic congestion syndrome. So I think that we need to get into how do we deal with pain for women patients, which is because we tend to have a very high scale and tolerating pain. And I think that is something that we need to get our eyes and our minds to.
Wonderful, wonderful. Any thoughts on that, Souad or Kathleen, before we close out?
Completely agree.
Listening to the patient and not disregarding because we do know women have atypical symptoms sometimes. They may have, and they, I agree, whether it is pelvic pain, it's heart disease, it's carotid symptoms, they could be different. And I think recognizing those and not ignoring them. All right, well, we are at the top of the hour. I want to thank you all, Kathleen, Anna, Souad, and Meryl. Thank you so much for joining us on this Saturday. Again, let me thank our sponsors, BD and Boston Scientific, and Venous and Lymphatic University. We have tremendous power here, and we have tremendous opportunity as well. So I appreciate all of you sharing your individual journeys, as well as some opportunities for systemic changes that are being made, and we have seen some progress. Everybody has a story to tell, and everybody has a journey. I want everyone to stay tuned. Season 3 of EmPowHER will be coming up, and it will be, as Kathleen said, Empower All. That will be season 3 in our episodes for those of you that like to binge watch. So thank you all, and appreciate you all joining me.
Thank you
And
so much.
Happy Saturday.
Thank you.
Have a good day.
Bye-bye.